Hi, my name is Chelsea Barrett, and I'm a graduate nursing student at West Texas A&M University. Today, I'm going to be providing a discussion via video over my poster presentation. I chose the topic, Do Tanning Beds Increase Your Risk of Obtaining Melanoma? The reason why I chose this topic is I work at a dermatology clinic where I see the daily repercussions of skin cancer, whether it be from basal cell to squamous cell and to melanoma. And over the years, I have heard conflicting things where tanning beds do or do not increase your risk of melanoma. And since I spent a lot of time in my younger years in tanning beds, I wanted to know how this not only affects other people, but had affected myself as well. So that was my reason in choosing this topic. And so I wanted to start out in my poster presentation with giving a little bit of an introduction, which had a little bit of statistics on skin cancer itself and melanoma. Every year, 1 in 5 Americans, I don't know if you can see this, there we go, 1 in 5 Americans will develop skin cancer in their lifetime. And to me, that's crazy that 1 out of me and my 5 friends could potentially have melanoma or some form of skin cancer. So it's important to try to minimize the risks we put ourselves at for skin cancer. More people develop skin cancer because of tanning than they develop lung cancer because of smoking. This was a crazy statistic for me, and I think it really drove it home to me how important this was, because every day I feel like on the TV, I'll see a commercial of how nicotine or how tobacco has affected somebody in some form or fashion and contributed to lung cancer or to a trach or other things. And so I think it was a huge thing to me that tanning beds contribute more to it than actually smoking does to lung cancer. So I think that poses a real need to have this discussion. Also, 1 person dies from melanoma every hour, so melanoma isn't something that is super rare. I feel like it's growing, and it's something that's going to continue to be a part of our practice as nurse practitioners. Between 40 and 50% of Americans who live to the age of 65 will have skin cancer at one point in their life. So that's important to me as well, because as we're in family practice, we need to be able to look for signs as patients come in and as they begin to age, and make sure that they aren't having any skin changes. Also, what was another really shocking statistic for me that I had found was the direct cost of medical care that was just pertaining to indoor tanning, and how that affected affected U.S. healthcare. So the direct cost just contributing to indoor tanning alone to take care of it, to provide help for skin cancer, was $343.1 million, and that's annually in the United States. So to me, if I could help to reduce that number in any form or fashion, or we could help to diagnose a skin cancer before it got to a point where it caused or you had to have a skin graft or things, if it's something that can be removed and taken care of fairly easily, then we as providers need to be able to find and catch that and take care of our patients in that way, and also reduce the risk of having to pay a lot more into healthcare to do other things to correct it, to do reconstruction for the skin cancer that was obtained. Women who have ever tanned indoors are going to be 6 times more likely to obtain melanoma, especially in their 20s, than those who never tanned indoors. So again, this not only just affects the older population, but it affects your younger population as well. So it's something to ask our patients about, especially if we can tell in their skin it's leathery. Like you can almost tell if they've been out in the sun a lot. And so we want to take that time to just educate them on the importance of reducing the amount of time and trying to keep them from using indoor tanning at all. The more men and women tan indoors, the higher their risk for developing melanoma. So again, that was just a statistic that kind of reiterated what my topic was over, and did prove that, yes, the more times that you tan indoors, you're going to put yourself at more increased risk for getting melanoma. The literature review I found quite a few topics on this. One topic was how the tanning industry sells the tanning beds as a safe alternative to UV exposure. They say that you're providing your body with vitamin D and biosynthesis, and that in turn is more important than the potential repercussion of obtaining melanoma, because your body does need vitamin D. So they kind of sell it in a way that makes it desirable and doesn't actually provide the correct statistics. In this article, it shows that data suggested that tanning beds are not safer than solar ultraviolet radiation, and that they may have independent effects from solar exposure, and that in turn increase the risk for melanoma. And the next article here states that indoor tanning does remain a driving force of melanoma among certain populations and is the single preventable driver of incident melanoma. So tanning beds are a culprit in rising melanoma diagnoses. So as providers, wherever we can, we see so much that's our patients will obtain just because of genetics. And so wherever we can try to help them in preventing something that is completely preventable, then we want to do that. And so we want to be able to provide them with the education that they need to know that tanning beds are the main culprit and can be prevented. And so I think that's an important thing to reiterate to our patients. Again, this article states that a person with more than 50 hours, more than 100 sessions, or 10 or more years was going to be 2.5 to 3 times more likely to develop melanoma than a person who had never tanned indoors. So you also have to think that melanoma also comes from just sun exposure outside, but you're going to be 2.5 to 3 times more likely of obtaining melanoma if you did indoor tanning rather than just being outside from regular sun exposure. Another study showed how the limitations of earlier reports provided strong support that, yes, tanning devices are carcinogenic in humans. So again, cigarettes are carcinogenic in humans. Tanning beds are as well. So we need to make sure that we are trying to educate them on reducing and limiting their exposure to tanning beds. Melanoma has occurred more often in those using indoor tanning than those who'd never used tanning devices. Also here it states that melanoma's risk was directly related to the frequency of tanning, total hours, the sessions or years, and age, how all of that impacts how it increases your chance of melanoma, which we'll dive into a little bit more in our methods and results section. There was a study done that states that more than 10 tanning sessions is most strongly associated to a melanoma diagnosis, and there was no association or no difference in the association before or after 2000. So in this one, it was trying to say how people have said now after 2000 that they have put things in place that states that the tanning beds are now safer, and that is inaccurate due to this study. And then their last review states that an aggressive initiative to reduce indoor tanning in the United States wanted to design prevention efforts tailored towards specific high-risk groups and the need to better inform the public of the risk of indoor tanning. Of course, if you have fair skin, you're going to put yourself at more risk for obtaining a skin cancer in general, just poorly due to genetics, but also if you reduce your exposure to the sun as well as to tanning beds, you may increase your chances of not having one. So in my methods and results sections, it was a study that was performed in Minnesota, and it was just, they took a questionnaire and a self-administered in telephone interviews that basically collected information over had a patient ever initiated an indoor tanning, the type of device that they used, the initiation age, period of use, the duration of time they used that, and any indoor-related burns that they had. And so here you can see in this first diagram here, this is showing how the hours attributed, the more hours you spend in a tanning bed, the more you're increasing your risk of melanoma. I think if you gosh, this is hard. You can see that. And then also this one is talking about the age. So the age that you actually start and initiate tanning actually does increase your risk as well. If you started before the age of 18, you're at more increased risk than you are if you started after the age of 35. And you can see that there. So starting beneath the age of 25, you're going to be at more increased risk. Also here, the number or the years used, the amount of time that you've spent in a tanning bed, the years that you've been there, also increases your risk. So 10 or more years, you're at more risk of obtaining melanoma. So overall, my summary just showed that indoor tanning does increase your risk of developing life-threatening melanoma by 20% from just one indoor tanning session. So just tanning one time for a special event, and you may think, oh, I'm not going to do this lifelong, I'm just going to do it one time. You have already put yourself at increased risk for obtaining melanoma by just doing that one session. So that's what. Now we're going to go on to how we're going to apply this to our clinical practice as nurse practitioners. I want to counsel patients to use sun protection. I want to let them know sunblock is key. UV sun protective clothing is really important to be using when outside. Sunglasses, hats, all of that is very important in preventing yourself from just regular sun exposure from obtaining melanoma. Just on indoor tanning alone, I want to educate patients on the health risks of that and display statistics so that they know that they can kind of see what I've shown you in this poster presentation and how it will affect them. Also want to educate patients to perform self-skin checks. It's so important that at home that they're able to do that. They'll notice any change within their body before we as healthcare providers would notice if anything had changed within a mole on them. So I think it's very important that they are educated on how to perform those checks at home. And we want to educate especially on the detection of melanoma by the ABCDEs of melanoma. So the very first one is asymmetry. So that's where you start to see that it's not normal and just straight around, but rather it's more jagged and asymmetrical. The border, again, borders are uneven. They're not just round in a circular motion again. Color, there usually is multiple colors to melanoma. Can be black, purplish, blue even, kind of a hue, but you're going to usually see more than one color present within that. Also, D is the diameter, so usually greater than 1/4 inch is going to be indicative of melanoma. And E is if it evolves. So if you have any mole that changes in its presentation at all, and that means shape, size, color, that is going to be of concern. And so patients need to be able to monitor their own skin and notice if they have any changes within their skin. Thank you so much.